COVID-19 Oversight and Engagement Board on the 19th of August 2021. I'm Councillor Matt Golby. I'm the chair. Councillor Helen Harrison is the vice chair. So welcome everybody. There's a number of councillor colleagues on the call this morning. So perhaps when colleagues announce themselves for the first time, we could just say where we're from, just so we don't have to do a long round of introductions, if that's okay. So we'll go straight into welcome and apologies. We've got apologies from Councillor Smithers, Danny Moody, Councillor Eales, and we've got Councillor Roberts representing Councillor Eales. Is there any more apologies we're aware of, Cheryl? No?
Just Councillor Bignell.
Okay, thank you. So we'll have a look at the minutes from the previous meeting on the 8th of July. Are there any issues, errors? Are we happy that that's a reasonable representation of the session back then? Yeah, jolly good. So we'll move on to the action log. Cheryl, are you okay to pull this up and we'll have a look at it?
Did you want me to screen share or just run through the actions?
We may as well screen share just so we can see what's on there. Okay, I don't know if everybody can see that, but there we go. So the first one, do you want to run down? Oh, there we go. So the first one is Kath will provide a small briefing on vaccination and testing for Health Watch Northamptonshire to include in their monthly newsletter, and we've got that as a green, so we're happy with that. Yeah. The chair and vice chair circulate the contact tracing update slides to their respective elected members, and we've done that. And Danny Moody is to be added to the refresh membership, and we've done that, but he's not with us this morning, but I'm sure he will be next time round. Any comments? Is everybody happy with those actions? Yeah, good. Okay. So is Simon with us, Cheryl?
He hasn't joined yet, no.
Okay, so we'll come back to Simon then. So the contain framework, item 5. Lucy, you okay to take us through this?
Yep, I think Cheryl's got some slides as well, but I'll take them as read. I think they've been circulated round. So I'm sure people who have been attending on a regular basis for quite some time now will remember we obviously work to the current government guidelines, and one of the requirements of public health teams and local authorities is to produce a local oversight, through the Local Oversight and Engagement Board, have a local outbreak management plan, affectionately known as the LOMP. So the LOMP obviously needs to be updated because we have had a new contain framework published by government. It was delayed, so we obviously have been providing updates for any of the significant changes, but we're now in a position with the framework having been published to update the overall management plan. I've actually last night been sent the first draft by the team, but people will remember on the County Council website and through our Western North website links, you can get to the previous outbreak management plan, but these are basically a summary of the main changes. I won't go through them in detail, I'll just sort of cover the areas that obviously have changed. So if we move forward. So for those that have obviously seen it, the contain framework, as it always has done, outlines, as I said, the roles and responsibilities of the local authorities, the local system partners, and then the regional and national teams and some of the governance between them, and the decision-making and instant response structures. It sets out the support that we can expect from those partners, and particularly at a regional and national level, and those obviously on the main part include the regional convener, the JBCs, the Joint Biosecurity Centre, and Public Health England, the Department of Health and Social Care. It obviously also updates the core components of the response, and therefore also covers things that are more updated since the previous iteration around things like variants of concern, vaccination, but it also obviously talks about how those new changes need to be factored into our local outbreak management plan. So if we move on. So as I said, we'll just literally talk about the kind of the main areas. It talks about enabling the public to make informed decisions. We know that the narrative has very much changed to people taking individual responsibility, not only for protecting themselves and their immediate family, but also their wider community. So the responsibility of the local authority is obviously reinforced around making sure that we provide up-to-date, accurate information to enable people to make informed decisions. If we move on. So we obviously have to retain contingency measures. So I have a statutory responsibility as Director of Public Health, and we have a statutory responsibility as a local authority to manage infectious diseases that pose a risk to the wider population that we serve. Obviously, it reinforces the requirement for us to be able to have an appropriate contingency plan and resources to enact any surge capacity. So we will recall that we've done things like surge testing when we had areas with high incidence, and we have also done door-to-door knocking from a point of view of getting people involved and engaged with vaccination conversations where we've had low uptake. So it's being able to make sure that we can demonstrate that we can rise to a challenge or any particular issues that may emerge. And thirdly, that is an integrated system response. So obviously we still have our local resilience forum arrangements in place. We're still having that recovery coordination group meeting on a regular basis. And indeed, because of the current situation where COVID is plateauing, we're starting to look at how we reinstate some of those wider civil contingency and local resilience forum meetings and responsibilities. So if we move on. Again, we've touched on this already, but making sure that through yourselves as elected leaders and councillors, that the local authorities are accountable for the communities around our response, decision making and expenditure. Obviously, people will remember that we have a contained fund that is very specific to us enacting these responsibilities. And obviously, I also have a duty to make sure that that is spent according to those grant conditions. If we move on. So the core activities as outlined in the contained framework now are obviously testing, both PCR, which is the one for symptomatic people and those that have been told that they are a contact, and then obviously the continuation of the lateral flow device testing. So those are the rapid 30-minute tests you can do at home, which we recommend doing twice a week. So we obviously have got a range of services available, both through a roving model, so literally kind of a mobile lab that goes out and does testing at various locations. We're particularly focusing that on hard to reach communities, those where we've got high levels of COVID, contraction and communication between the communities, but then also where we've got areas where we've got things like low testing, from a point of view of that being a kind of a recurring issue. So making sure that we're taking testing out to the communities that otherwise don't engage. We obviously also have a number of pharmacy and asymptomatic testing sites that you can collect your asymptomatic tests from, as well as have facilitated tests. And as I said, we've got the PCR sites that will remain for the foreseeable future as well. We move on. So contact tracing continues to be a requirement. There is a national team, but most of that responsibility is being delegated down to local authority teams over time. We have a robust contact tracing partnership, and I'm sure you'll remember, I think we were the third local authority to set that up off the back of the Green Corps outbreak over a year ago now. So, we have a very well established routine and relationships with both the regional lead for contact tracing, but also that national team that we continue to work in partnership with at the moment. We have a good rate of follow-up, as people will have seen by the reports that we produce for these meetings. And we obviously have things like support that's available that other local authorities haven't put in place. We have a very good social isolation support pack, which has been obviously adopted and adapted by other local authorities and is been sort of heralded as good practice indeed. So again, that touches on being able to remain provide and continue to provide the self-isolation support for those people, both from a point of view of the emotional support, food packages, medication deliveries, but also financial support for those where statutory sick pay may not be available, and or where there are other circumstances where they would likely not be able to either continue with their self-isolation if they weren't provided with financial support, or indeed may experience financial difficulty. If we move on. So last couple of things, obviously vaccination is a big element of us being able to continue to move forward with the freedoms that we've been granted. We have had a very good start from a point of view of vaccination uptake. That has slowed more recently, and therefore obviously we're making sure that we continue to work with the vaccination teams to take vaccinations again out to those communities that we find aren't as engaged, making sure again that we provide the appropriate information to address any issues or concerns that may arise. And obviously make sure that as we particularly come into winter, that the booster campaign that we'll be starting within the next few weeks is obviously supported with all of the right data and information by the business intelligence teams. Last couple of slides. So key enablers, obviously, as talked about the funding that we have, the Contain Fund. We do have operational support. We haven't ever had to use national teams, but obviously we have had visits and advice and support from Cabinet Office. We have also, as people will remember before, had MACA support, so the military support. Obviously, thankfully, touch wood, we've not obviously been in a position where we've needed that to continue, but it is worth noting that that is obviously still available as part of the national structure should things change. Obviously a big enabler, and I'm sure it's worth mentioning again that we've been nominated for an award for the communications and engagement work that we've done. Been very, very strong locally. As I've mentioned, a lot of other areas have indeed used it and adapted it, and we've shared it freely as well for that reason. So obviously it's going to continue to be key as we go forward as well, to make sure people understand how to access all the tools that we've got available to continue moving forward out of the lockdown. And obviously that other enabler is maintaining that outbreak management plan. Last slide, Cheryl. So obviously, as I said, we've got the draft plan being updated. I'll be able to share that with you next time. We're making sure that all of the protocols and policies around testing, vaccination, etc., are all updated to reflect the changes in the new Contain framework. And that plan obviously will go to our regional convener for review and sign off, as well as come back here to the Oversight and Engagement Board. So yes, obviously it's just worth noting at the end there as well that there will be new ways of working, because the UK Health Security Agency comes into being on the 1st of October. So that's where Public Health England is being split up into 3 main component parts, and that will be the element that looks after health protection going forward, and it will also consume, while it continues to exist, the Joint Biosecurity Centre. So it is worth noting that we will have a new agency to work with, but it is just a part of the old construct. So lots of continued relationships with people that we already work very closely with there. But I'm happy to take any questions, Matt.
Excellent. Thank you, Lucy. Very interesting. So colleagues, if there are any questions, if you could raise your virtual hand in an orderly way, and I'll bring everybody in. So are there any questions to kick off? Perhaps I'll start, Lucy. You mentioned regional and national relationships, and you know, some of the work you've done. I just wondered have they been tested at a sort of regional level, and who have you sort of had to deal with? And I'm thinking of regionally in council speak, East Midlands councils. Have you had any dealing with those and colleagues, you know, in that region?
So we have a weekly East Midlands Directors of Public Health meeting, and so obviously they're all statutory officers of each of the local authorities in the East Midlands. So we share the plans, we share insights and information around what the challenges are in local areas. For example, at the moment, Lincolnshire, for the East Midlands, as I'm sure people who have seen the data will see, that's got quite a high rate at the moment still, very much driven by some issues in Lincolnshire around Ministry of Defence settings and outbreaks there. So again, it's really useful to understand some of the areas that are particularly hot still, and obviously understand the plans that people are putting in place to address those. We also have links into the national and regional meetings that are led by our various regional conveners. They also meet regularly at a national level. So again, Helen Marks, who's our regional convener, will be able to feed back information from other local authorities. And I'm sure, although not so much nowadays, because I think people are returning back to business as usual more, but a lot of those programmes of work were actually led by local authority chief executives at various points in time. So, you know, particularly from Nottingham, we've seen a lot of the chief executive in Nottingham talking about some of the contained framework development and some of the, you know, contact tracing development work as well. So there are links in with other local authorities. I think we'll see more, as we should do, that the responsibility gets devolved back down to Public Health England, or as will be UCSA, so the UK Health Security Agency, and local authority public health teams, again, always with that statutory responsibility around infection prevention and control, infectious disease management. We'll start to see COVID as business as usual as well, or at least that's our hope. So I think you'll start to see some of our more normal business as usual arrangements come back into place, and therefore local authorities will start to go back more so to just dealing with the other bits that they've obviously got to continue to deal with, and not just have to be as heavily focused on COVID.
Excellent, thank you, Lucy. So we've got Helen first. Helen.
Thanks, Matt, and thanks, Lucy. Really clear introduction there, as always. Lucy, I've been hearing various GP practices and others saying that, you know, despite inviting the entire cohort to come forward for vaccination, they're getting to a point of, I suppose, saturation, that, you know, people are not coming forward in great numbers anymore. And that they're really concerned that the vaccinations that they've got are going to go past their expiration date, and are rather desperate to get them to places where they can be used, because obviously it's a very precious resource. And I just wondered if we had anything within our plan that enables us to you know, really monitor what vaccines we've got, how close they are to expiration, where they can be sent if we're not able to use them, be it another part of the country or even abroad.
So that's not anything that I've had feedback on. So if you do have any formal information that you can forward on to me, I can forward it on to the vaccination programme director. Obviously, that's not a programme that sits in the remit of the local authority or the Director of Public Health. I'm absolutely assured that they will have plans to make sure that they obviously utilise as much of the vaccine as possible. It's something that we do for flu vaccination every year, so it's something we're used to, albeit that COVID vaccinations are more fragile when it comes to obviously transporting them, as you know. A lot of the GP practices won't see as many people present, because the thing that we have found with younger people is they tend to just like to pop to the vaccination centre, as opposed to GP practices. They don't have the same kind of relationship as the older population do with their GP practice. So I think you'll see a disproportionate number that have actually probably gone to the vaccination centre, as opposed to necessarily engaged with a set appointment with their GP practice. Having said that, as we know, we still want lots more people to be engaging in that, particularly in the younger age groups. But I think it would be, if you've got any information you can send to me, I can forward it on to Chris Pallow, but I think it would be worth us asking Chris to come back and maybe give us an update on some of those operational challenges as we go into winter as well, because obviously we've got the booster programme starting. So I think perhaps if he's willing, it would be good to have him come and answer some of those more specific operational questions next time.
Brilliant, thanks. I will forward the one particular issue on to you, Lucy. Thank you.
And Chris has done an amazing job for colleagues' information. He's the director of the vaccination whole programme, isn't he? And he has come and spoken, I think, at this and at the councillor briefing as well. So he's been quite accessible, but it'd be good to perhaps get him back to give that update, as you say, Lucy. Okay, we've got Emma Roberts next. Emma.
Thank you. Thanks, Lucy. Just a couple of questions. The first one around the great work that's clearly been done around isolation programs and engaging people. With the changes to the isolation rules and the ping process, etc., what plans have we got in place to make sure that we maintain that self-isolation and engagement program? Because I think, well, personally, the rule changes can be a little bit confusing, and giving people flexibility often causes us a problem. So that's the first question. The second question is around the vaccinations and actually the take up of vaccinations for employed WNC workers or across the county generally. I understand that there's about 600 workers in West Northants that have still not had the vaccination, and with the mandatory vaccination programme set to roll, that's going to pose a real difficulty for our particularly adult care sector. So I don't know whether that's an issue that this board has considered, but it feels like it is a kind of a central location that should be looked at.
Thank you, Councillor Roberts. So self-isolation, yes. Some interesting changes. I think it's clear that a lot of clinicians, myself included, have raised concerns about some of the changes to self-isolation. I think in particular, and it's one of the reasons that the local narrative is very strong around this, is we absolutely understand that double vaccination affords you some level of protection from a point of view of contracting the virus. It doesn't stop it happening, but it does reduce the likelihood. And obviously, if you are infected, it reduces the severity of your symptoms, the duration of your symptoms. And there's evidence of the fact that obviously it reduces the likelihood of further onward transmission from you. It doesn't negate any of those. So one of the things that we are very strong on locally, and we have been both with our staff and with our public comms, and Kath may come on to this later as well, is the fact that government guidance says if you're 14 days post your second vaccination and you're identified as a close contact, you do not need to isolate, but they recommend you get a PCR test. We are being very strong on that recommendation. We obviously cannot mandate it, but clearly I think logic tells you if you have been in close contact with somebody who is a positive, you are highly likely to have been exposed. You may not contract it and go on to become infected or infectious, but common sense would suggest that it would be very sensible to get a PCR test. Now, the challenge being that obviously the 10-day isolation period was because you could develop symptoms and obviously your viral load would increase if you had been infected over that 10-day period. The challenge is obviously if you are identified as a contact, you go and get your test within 24 hours of your exposure. It's highly unlikely, even if you have been infected, for your viral load to be high enough for that PCR to come back positive, yet you could develop the symptoms and or becoming, kind of obviously infected over the next 10-day period. So we are suggesting that people need to obviously take that PCR test, but think about the timing of it. And then obviously still engage with those twice weekly lateral flow tests, because they obviously are going to be key to identifying if you do end up with a higher viral load over the subsequent 10-day period. We are obviously not suggesting that we don't follow government guidance. We all need to be moving forward. It's just erring on the side of caution and making sure that you assess your personal risk and the risk that you may pose to others if you indeed were identified as a close contact. For our staff, because obviously our staff do come into contact with vulnerable people, we are asking not only do they get a PCR test, but they isolate until they do get the result. And again, that is a staff body decision across both local authorities because of the level of vulnerability that we do deal with, particularly with our frontline staff. Clearly that will still significantly reduce the impact that was the pandemic, where people were having to isolate for 10 days and they may have been in contact with somebody through a brick wall because of the sensitivity of the app. It clearly significantly reduces the risk of staff shortages, but we do obviously want to make sure that we're protecting our staff as we have to as employers, but also protecting the people that we provide face-to-face services to. Is that okay from a point of view first? Yeah. I know, in fact, the police have taken an even more robust approach to that as well. So again, for all of the reasons around risk. But with relation to vaccination, the mandatory vaccination, particularly for staff that will be going into care homes, it is something that both of the directors of adult social care are very cited on. They have got all of the data from a point of view of understanding how many of our directly employed staff it relates to. Obviously, there is a wider commissioned service impact as well, and that's less easy for us to get exact numbers about because we've got a number of care homes and domiciliary care services, etc., where staff obviously are employed on our behalf. But from a point of view of our directly employed staff, we're aware of how many staff that impacts. We've already had a focus group session with staff to provide them with further information, make sure that we've busted any myths that might be circulating around the vaccination, provided them with information about how and where to access the vaccination should they wish to. There clearly is still a resistant group. and it obviously is completely personal choice. But what we have done is made sure that we've exhausted all of the options from point of view of trying to give them the right information, accurate information, and make the vaccine as accessible as possible. It is something, as I said, that the Director of Adult Social Care are keeping a very close eye on, because it will, to an extent, impact on staff availability. But obviously, we also have a duty to make sure that where we can redeploy those staff into non-frontline, non-sort of customer-facing roles. But undoubtedly, it will potentially impact on some people's, obviously, ability to continue to do their job, and therefore the DASs are working through that with the staff to look at the implications.
Thanks, Lucy. That's helpful. I am picking it up separately with our director, and I know that it was discussed at the Adult Safeguarding Board, as colleagues have provided with a note from that. But I just wonder whether we need to have a wider oversight, because I actually think the issue is bigger than that, and it is a crisis situation with regards to vaccinations within that sector. The rules don't say that a member of staff should be dismissed for not having the vaccination. No. It says they can't enter the care home. So I think we have to look at how we work on that, and I wonder whether this board should just have an oversight of that kind of project, and then also any additional encouragement. How can we encourage people to have that vaccination? I fully appreciate that you're already doing work with engagement, but I wonder whether there should just be a report back to this board on that, given the imminence of the programme.
I mean, I think there's a number of committees, etc., including those that are more HR related, that obviously have involvement in this, but it's obviously up to the chair if he would like a report back, and I'm sure we could take that as an action if Councillor Golby wants to have that here.
Yeah, sure, we can have a chat about that after the meeting, Lucy. Okay, so we'll move on to Emily. Got Emily next.
Thank you, Chair. Thanks, Lucy, as well. Thank you. That was really interesting. And yeah, just a quick follow-up question on Emma's. I just wanted to find out what you would say the recommended incubation period is before you get a PCR if you've been exposed. Is there like a recommended date?
So from a point of view of the average point at which you have a viral load, if you have been infected, for it to be picked up is 4 days. Obviously, the challenge is that if we're asking people to isolate until they have a PCR and get a result, that obviously has significant implications if you're a frontline worker. So it's just trying to make sure that if you're able to work from home, you can obviously have your PCR a little bit later. If you are a frontline worker, you would need to obviously try and take your PCR as soon as possible, and that's where the lateral flow tests then obviously come to the fore and provide you with that sort of safety net for the longer term.
Yeah, absolutely. Okay, super. And then my actual question was around, so obviously you're sort of saying about COVID becoming sort of more business as usual and going forward from this. I wondered if the communications team was looking at encouraging masks as a more longer term sort of thing, not just for coronavirus, but for sort of other illnesses as well. Obviously, we're sort of going back out into the world now. People are actually starting to get just normal sick as well. And yeah, quite a lot of other countries are obviously making use of that. And I think this use of sort of this awareness that we now have of sort of personal hygiene and other sort of hygiene factors as well. I think it's something that we could possibly leverage. I don't know if that was something we're looking at.
Kath, I don't know if you want to come in on this, but I think just a really interesting observation is, and I'm sure Julia will say the same as the Director of Infection Prevention and Control for NHFT as well. We've had no norovirus. We've had hardly any flu. We've had so few infectious disease transmissions over the last 18 months. It's been extraordinary. So it just demonstrates what social distancing, enhanced hygiene and face mask wearing does do. So I absolutely recommend that there is a place for masks. Julie, I know it's been an absolute joy, hasn't it, from a point of view of the other infectious disease rates?
It has. We've seen very little, haven't we, over the last 12 months. Masks have made a difference, and this is one of the big concerns, isn't it, with people not wearing masks and not necessarily built some of the natural immunities they would have done in the winter seasons, that we may see an increase this year. Yeah. Because as we come out of masks, so people do need to continue to consider whether they're wearing masks as well. And certainly for me, I'm still wearing mine. Yeah.
Kath, do you want to just touch on the comms there?
Sure, yeah, I think it's a really good point. So I'll cover it in more detail in my section anyway, but one of the messages we're really trying to get out as everybody returns to some sort of normal is that people have different kind of attitudes to risk, dependent potentially on their own illnesses or conditions, and that certain scenarios present more risk. So it's really in those settings or those circumstances where we're asking people to consider wearing face coverings. So indoor areas, crowded indoor areas, public transport, when you're meeting someone who might have a long-term condition or be more vulnerable. So that's what we're trying to encourage: personal, sensible personal responsibility and making those decisions in the right places. And, things might change as we go into winter with a heavy flu expected as well. So we'll just have to watch and wait with government guidance. But for now, that's what we're just trying to educate people, that in higher risk settings or circumstances, face coverings are recommended.
Thank you.
Okay, thank you. Emma, you put your hand up again.
Yeah, thank you. Just a quick comeback on the question, on the points that Lucy and Julie made around norovirus and other infectious diseases. And I think we've all seen that people have sort of been healthier almost, particularly children. I know my daughter's not experienced any runny noses at all. I haven't had one. How do we manage that? So I know there's the mask wearing, engagement, etc. But how do we manage that moving forward? And what happens? And will we be ready? Can our services cope if we see this release happen and everybody gets all of the other bugs that they had before?
So can we manage it is the big question, in all honesty, Councillor Roberts. The challenges, as we've just touched on, is it's been a joy from a point of view of those with responsibility for managing infectious diseases, because although COVID has been, extraordinarily difficult, we haven't had the complexity that having a number of the other normal, particularly winter-related viruses circulating. They basically just dropped off. They have started to re-emerge again, just out of interest. There's been 2 significant norovirus outbreaks in the East Midlands this week, not in Northamptonshire, I might add. But we clearly are headed back into that territory. At the moment, all of our NHS services, and that goes from 111 to GP practices to EMAS, the ambulance service, through to hospitals, adult social care, are extraordinarily pressured. And that is not because of COVID. COVID bed occupancy at the moment in the acute sector is about 4%. So, it is a handful, not even that really, of beds that are being occupied by COVID. Yet it feels like the middle of winter, doesn't it, Julie, from a point of view of the pressure on all of our systems. So that is going to be the real challenge, is how we ensure that we contain any potential, 1, spike of COVID, 2, any potential surges in other infectious diseases, such as flu. Obviously, that is a huge demand from a point of view of hospitalisations, usually through winter. But, basically we've got to try and maintain system flow. This is not a problem unique to Northamptonshire, it is a national problem. And there are a number of very senior people talking about how we obviously support services as literally through from start to finish that I just mentioned, to make sure that winter, it isn't as difficult as it has been over the last couple of years, and certainly potentially feels like it could be more difficult this year, because you've got potentially coronavirus on top of what would be a very difficult flu season already. Julie, I don't know if you want to add anything more to that, but it is obviously a hot topic locally as well as I've talked about nationally. And our challenge as well is making sure that we have staff capacity. This isn't about just opening more beds. This is about, obviously, you need all of those staff to be well and to be available to provide the support as well.
I think you've covered everything, Lucy. You're right, it's not about opening more beds or increasing services, because actually it's the staff. It's ensuring that we've got a workforce that are able to deliver this as well. And there is a lot of planning going on, both regionally, nationally, and within county, looking at health services. We never actually stop winter planning, but we are winter planning, ready for. And there's lots of predictions and all sorts around at the moment as well, looking at what the next few months could hold for us in health and social care.
And interestingly, just to add, we don't have them as often as I would like anymore, because we used to have them weekly, but they've dropped down to fortnightly. But with all of the directors of public health nationally joined the chief medical officer, Chris Whitty, for a briefing, and he was very clear yesterday that he, or we collectively as a system, have no idea what will happen after September. So with schools returning, it is almost impossible to model what COVID might do, and it's equally difficult to model what flu might do this year. Because somebody mentioned earlier, and it's a very good point, is masks, etc., obviously provide a benefit from a point of view of reducing onward transmission of a number of respiratory diseases and viruses. The challenge is that actually, by nobody being exposed for the last couple of years, we have no natural resistance. We haven't built up any natural immunity to the flu strains that are currently circulating. We also therefore aren't completely sure which strains may hit us. So our vaccines may not actually contain the right strains for us to be able to protect the vast majority of the community. So flu is extraordinarily unpredictable this year as well. So that is a complication, and obviously if people are concurrently infected with both, the outcome is usually very poor. So we need to be very, very fastidious about how we manage that.
Thank you both. That's really helpful. But just very quickly, one last point. Is there any plan to extend the flu vaccination offering as a result? Yes.
So this year is being extended again. So I don't know if people remember last year, it was extended both for children, but also down from 65 and over to 50 and over. And again, it's going to be exactly the same extended flu programme this year.
Okay. And any encouragement or comms to employers who are able to offer vouchers, etc., for people?
Year. Yeah, we do it every year. So it's being picked up. There's a system comms campaign. It's already being worked up, and it will start literally within the next couple of weeks.
Okay. Could maybe that could be shared with councillors, because I've never seen that, Lucy. So
yeah,
perhaps that could be shared with councillors, and we could work with local employers to encourage that as well.
Yeah, more than happy to. I'm sure Kath will make a note, and we'll make sure that goes around in some of the councillor briefings, etc.
Thank you very much, all of you.
Right, let's move on then. We've got Simon here. Welcome, Simon. Oh, sorry, I've got another question. Sorry, I didn't see the hand. John Paul. John Paul, did you want to come in?
Yeah, just going back, Lucy, to that point you said about over 55s having the flu jab and things like that. I know when I had my flu jab last year at my local chemist, which I live 15 doors away to, it also included if you were around vulnerable people. So in my case, being my father, is that going to be the case as well this year? Bearing in mind I am under 50.
Of course you are. So usually it would be registered carers. Obviously, if you feel that the circumstances have changed and you're not maybe potentially registered as a carer within your GP record, then you can speak to your GP practice about that. Because obviously people's circumstances change year on year, and unless the GP practice is told that, they won't know. So absolutely, if you have a caring responsibility, then it is worth making sure that your GP practice is aware of that, and it potentially then obviously puts you in an eligible category.
It's right. I know when I did go to the chemist, there was a checklist that they went through, and I hastened to her. She just said, "You are your father's carer, aren't you?" and
exactly. Exactly. It's a very permissive system. We are much more likely to give you a flu vaccination than not, assuming that we have the supply. Yes.
Thank you.
Good. So apologies to Simon. So we'll bring Simon in, who is the Assistant Chief Constable. So Simon will give us the police update, if that's okay, Simon.
Yeah, thank you, Councillor, and apologies for being a few minutes late for the meeting. I'll be brief with my update. If I can cover off some of the points we made already, just from the police perspective. Nationally, we've been advised to work with our local Director of Public Health regarding how we manage our police officers and police staff in the workplace, which is what we've been doing. So as Lucy alluded to, we've got our own system in place. We've actually maintained wearing face masks within the workplace, in custody. We've maintained numbers that are sitting in offices, etc. You'd have seen, hopefully, when officers are out double crewed, they're still wearing face masks. When they do that initial engagement with the public, they'll be wearing a face mask. And then once they've assessed the situation, possibly take it off and appropriately socially distance. So from a policing policing point of view, we have really just maintained business as usual as to how we're dealing with it. We're obviously very concerned at making sure that we maintain officer numbers and staff, so we can still continue to maintain that service. We did suffer from the pandemic early on, and we had to seek dispensation from the government, which was given for some of our response officers, firearms officers, etc., in order we could maintain. Now that's gone, we've got the other systems in place. We're not too bad with some officers self-isolating. So that's been maintained. Issues sort of that I mentioned at the last meeting, the Grand Prix at Silverson's been and gone, 360,000 people. I think Lucy's team was a little busy with some of that, but I have to say overall it was a success for the county, both the sort of the health operation, the policing operation, raising that, so that was positive. And we've got the MotoGP coming up later this month, where we're expecting large crowds, but not to the same number. Policing wise, with the pandemic, I think I mentioned at the last meeting, we really are back to normal now. Our incident levels are as they were if you go back 2 years ago, pre-pandemic. The nighttime economy's reopened, so we're now back to dealing with the sort of public order, drunken behaviour, etc., on all of our town centres as normal. We've had some really busy days, with some days hitting 3.9 levels that are up to New Year's Eve level. It almost feels like the sort of release has been done, and the public are now responding to that. We're now back to normal incident levels this week, which we're managing. Incident wise, we now get very few calls from the public that are COVID related at all on any issues. And it's almost, from our point of view, the public has sort of stopped calling us on these issues, and we're not picking up that much work for things like, I'm aware we've got the sort of the isolation hotel in Northampton and that, and we're not seeing much demand coming into the police from that either. So for us, councillor, very much business as usual at the moment, and we are putting in quite stringent protective conditions for our own officers and staff in order to maintain that service. Thank you.
Thank you very much, Simon. Are there any questions from colleagues? None at the moment. So it's looking like you've got away quite lightly, Simon. But thank you very much, and thank you and your colleagues for the amazing work that you've done all the way through this. It's obviously been a challenge to us all, hasn't it? But you've reported to us regularly on your challenges and what you've faced, and police have done, as everybody has, an excellent job. Right, so we will move on to the next item. The weekly surveillance report, Lucy, if that's okay.
Yeah, and Cheryl's going to, well, she won't tell me off, I'm sure, but she won't be happy with me. I think what I thought might be sensible, and I only thought about this morning, so I apologise, is we didn't produce the surveillance report last week because of the IT issues. Which couldn't get onto the system. I'm sure everybody else suffered in some way, shape or form with some of those challenges. What I do have, if you're happy for me to share the screen, is I just have the update from a point of view of the North and West Northamptonshire profiles. So I thought, rather than give you data that was very much out of date, these are the two most recent reports. So these data up to the 12th. So obviously you saw the surveillance report was only data up to the 1st. So I thought this would be better. So this is the picture in Northamptonshire. So good news is the fact that we're maintaining good testing rates. In fact, that's actually increased. And again, as we've talked about, our comms are very concentrated on that at the moment. Naturally, if we've got high testing rates, you do tend to have higher positivity. It is going up nationally at the moment, and at this point in time, if I can, I can't flick because otherwise I'll change everything on there. We're actually slightly below the East Midlands average from point of view of positivity, but above the England average. And I did say the whole of the East Midlands is a slightly higher positivity rate and all-age case rate. The all-age case rate at this point in time in Northamptonshire is 307 per 100,000 population as a rolling 7-day average. That's gone up slightly, but not concerningly so. And it is, when you look at the borough and district level, some of them are plateauing, some of them are going up a little, some of them going down a little, and it's kind of hopping around at this point in time. The over 60s case rate has increased, and this is the bit that we're particularly keeping an eye on, because obviously we do know historically that over 60 case rates are associated with hospital admissions. Again, this is all reflecting the national picture, and it is a slow increase, but as I said, day to day the fluctuations do go up and down. This is driven, obviously our picture here, by the fact that we have had 3 outbreaks in the last 7 days, and in the north one of them is quite large, so we're into over 20 cases. It's in a work environment, so obviously environmental health officers and the infection prevention and control team are going out and supporting. And touching a little on what we'd said earlier about testing and vaccination being more targeted now, where we find that we've got larger outbreaks, and actually on investigation we've got a cohort of workers or whatever the situation may be, where we've got low levels of uptake of vaccine, etc. We're looking at trying to get pop-ups out there for both testing and vaccination. So this gives you a little heat map, and obviously you can see our case rate is the same across the piece. From a point of view of it's 200 plus per 100,000 population. That gives you an idea of where we are in relation to everywhere else. So it's a very similar picture across the piece. As I said, we're not an outlier from a point of view of the East Midlands trends, although the East Midlands case rate is slightly higher than the England average. From a point of view of the age group, so the darker, i.e. the black, in this is the higher age case rate. You can see there 17 to 18-year-olds is markedly higher than all of the other case rate ages, and then 19 to 24-year-olds being the second highest age group currently affected. That is absolutely, when you look at the exposures that are being articulated associated with the reopening of hospitality, particularly nightclubs, festivals, etc. So these are the age groups that we're very much targeting with our comms campaigns. In fact, Kath is being very specific about where we should be engaging and where we should be providing support. And we're also trying to explore things like using certain shops that people might go and buy some clothes before they go out to promote things like lateral flow testing, and even potentially give out kits. We're trying to explore if that's an opportunity. Obviously, I don't want to mention any shops here, but there are particular shops that people like to pick up, you know, a sort of cheap outfit for the evening that night. And therefore, it's an opportunity to engage with the age groups that are particularly being affected at this point in time. So from a point of view of picture over time, you can obviously see the cases for Northamptonshire there in the top bar graph, excuse me, and the over 60s cases in the second graph down, so here. Again, you can see this is the most recent 14 days from a point of view of males and females and 10-year age bands. So you can see continuously we've got this younger age group affected. Now, not only are they more socially mobile and all the things that we've talked about, but they're also the ones that obviously have only more recently had the vaccine available to them. So we would expect to a large extent for that to still be the most affected group. What we would have wanted to have seen by now, though, is in particular the 20 to 29-year-olds, because they have had the vaccine available to them now for quite some time, start to have reduced. We started to see that happen. I'm sure you can remember a couple of weeks ago the case rates were a little bit better. But as I said, this is a result of that final step out of lockdown and some of the areas that those people like to socialise in, obviously therefore has had an effect. So the number of persons tested, you can see, has gone up slightly, and we're hoping to maintain that position. But daily positivity obviously significantly dropped during lockdown again, spiked as we came out of the first part of lockdown, sort of came down a little and is back on its way up slightly, although at a slower rate. Again, this is following the national epidemiology as well. So if I just show you the same for West, you'll see it's a very, very similar picture. So if we just share that. Oh. There we go. So again, just quickly trotting through the main points. We've got a similar testing rate, a similar positivity rate, a slightly higher all-age case rate. Again, a similar rate from a point of view of over 60s. The good news is that we've seen a little reduction in the 17 to 21-year-old case rate, although not marked. As you can still see, it's very, very high. And obviously, we've had 2 community outbreaks in the last 7 days as well. So again, very similar picture from a point of view of overall case rate And again, you've already seen the picture for the whole of the East Midlands and some of the east of England. Again, very similar picture from a point of view of the age groups that are most affected. So you've got that sort of dark, dense section in the middle there, particularly the case rate for the 19 to 24-year-olds, and then followed by the 17 to 18-year-olds in this case. So a slight flip in the two age groups most affected, but again, obviously that's still that mainstay of 17 to 24-year-olds being the most affected. Again, very similar picture from a point of view of the epidemiological curve for both tests and also positivity and positive cases. And again, a really similar picture from a point of view of the most affected groups. You can see here quite a significant increase in the 20 to 29-year-olds and particularly the males here. So it is a very similar picture. As I said, it's similar and reflects the position nationally. For assurance, again, we still speak to Public Health England on a Monday evening every week. We provide a report back up to them about the circumstances, any outbreaks, any concerns we have, and that still goes through the weekly reporting system of bronze, silver and gold at a national level, and we then get obviously feedback from those reports. The Secretary of State attended in person this week to gold, and again has not raised any concerns about our area in particular. Very focused on making sure that we obviously maintain and improve our position with vaccinations across the piece as we enter winter, but otherwise no concerns at this point in time. And I think the reality is we're quite likely to see this kind of level of COVID bubbling along in the background now in the community for the foreseeable future. What we want to make sure though is it doesn't spike at all, and particularly in those groups where it may end up then affecting hospital admissions.
Okay, thank you very much, Lucy. Are there any questions from colleagues? If you could raise your hands. Okay, none apparent at the moment, so thank you for that. We will move on to the vaccination update. And I know Toby was going to do some of this, but he sent his apologies while we've had the meeting, while the meeting's been taking place. So Lucy, I think it's over to you again.
I don't think I've actually got any of the information to hand, I'll be completely honest. So what I think we might have to do is just send round some headlines. Let me just have a very quick look, because I probably have got yesterday's report in my inbox, which I do. So let me just tell you the quick headlines. So from a point of view of the, oh my goodness, it's so small. Let me have a quick look. Let's have a look. From a point of view of the number of vaccinations, we are now at 915,874 vaccines administered across the whole of Northamptonshire. And of those, it looks like we have got 659,500 of those are the people who are double vaccinated. And then we look like we've got 494,500 who have only had one vaccination. So obviously that's part of the overlap. From a point of view of cohort penetration, some of the challenges obviously still around our younger age group. Obviously people have only just become eligible in the 0 to 17-year-olds age group unless they were clinically extremely vulnerable previously. Good news is, just eyeballing this and looking at comparison to previous reports I've seen, we've now got good numbers in our, oh God, it's too small, bear with me, in our younger age group. Actually, we've got, just give you the figures, 36.85% of our 18 to 29-year-olds have now had their first dose only, but another 36.5% of the population have had their second dose as well. So there's only 26.6% remaining of that younger age group down to 18-year-olds who have not had any vaccination at all. So that's a significant improvement on the position previously. So that's really good news. Otherwise, obviously, we've got some variation in cohorts. And interestingly, looking at the epidemiology as well, the 30 to 39-year-olds, we've still got around 20% who haven't been vaccinated. So we still clearly have got some challenges around those younger age groups that we need to make sure we are obviously reaching out to and providing all the right information and accessibility to. But otherwise, from a point of view of just a quick overview, we're obviously progressing, but we need to make sure that we particularly pick up that younger age group, I think is the main message.
Good. And at the councillor update a few weeks ago, there was talk about the flu booster as well. And given we've talked about flu quite a bit this morning, do you want to just outline the high-level plans for that as well, if that's okay?
Yeah, absolutely. So as we mentioned earlier, we have got an extended flu plan again and offer this season. So children up to throughout school age will still be offered the nasal vaccination, and then we've extended the availability down to 50-year-olds from a point of view of the general flu vaccination. We obviously still have both the quadrivalent and the trivalent vaccines. So there's 4 different strains in the quadrivalent and 3 different strains in the trivalent vaccine. So we obviously cover off trying to make sure we've got as much supply and stock as possible. Just so people are aware, you can at this point have both your flu vaccination and your COVID vaccination at the same time. I think one of our challenges is going to be that you have to have 6 months between your second vaccination of COVID and your booster vaccination. So what we don't want to do is put off people's flu vaccination to try and time it with their COVID vaccination. So you may well get called for your flu vaccination before you're due your booster of your COVID vaccination. So please just bear that in mind. And obviously we would want people as early as possible in the season to start getting their flu vaccination to give them some protection. So for example, I know I wouldn't, if I end up being eligible for a booster for COVID vaccination, I wouldn't get called until December. I absolutely want my flu vaccination, in September or October. So I will definitely be attending twice. The one thing that we still have got to wait for clarity on is how many of the JVCI cohorts will be eligible for the booster vaccination. We are still waiting for that information. But as I said, eligibility for flu has been extended and been confirmed, and plans are in place, both from a point of view of obviously GP practices offering that to you, as you've already mentioned, JP, you can also get it from your pharmacist. We do obviously make sure that occupational health, where it's appropriate for frontline workers, provide vaccinations too. And obviously we will be offering it through our main vaccination centre this year as well.
Thank you, Lucy. Are there any questions, queries on any of the vaccination stuff? Okay, we will move on to the testing and contact tracing update, if that's okay. Lucy again.
Yeah, so I'll take the report as read. I think this is quite a standard report now as well. Obviously, just the main sort of points that are always, I think, worth summarising. If we just go to the that's it. Thank you very much. So we're at a 90% performance from a point of view of we are managing to follow up 90% of our cases. It's a slight drop. We were at 91%, but part of that is obviously because we've had an increase in cases. So obviously if we have many, many more to be managing, then obviously we have some capacity limitations. One of the other challenges obviously is in the last week we had to, for 2 or 3 days I think it was, push back all of our cases to the national team because of IT issues. We again couldn't access some of that, so that will have to a point affected our performance as well. If we just go on to our main, if we just go down again. So these are the numbers that we've obviously been looking at. So you can see the peaks and troughs from a point of view of the main numbers. But as I said, please note, we did have obviously the outage from a point of view of IT, and therefore we were unable to receive new cases, and therefore we had to send them back to the national team, and that will have caused a delay. So for that we apologise, and we'll obviously be following everything up that comes back to us. If we go on. This obviously just gives a breakdown, as we always do, with regard to the reasons for closure of cases, both those that are completed successfully. As I said, there's always a proportion that refuse to disclose any information. Now, this all may change as well, because obviously if you're identified as a contact, if you are double vaccinated, the need not to isolate may actually make people more willing to share some of their contact information. But obviously we will continue to make sure that we do call everybody, because one of the things that's really, really helpful for us, and because we've had this programme for over a year now, is this is where we pick up a lot of the soft intelligence about where people have been and where their potential exposures may have happened. And for example, it's one of the reasons that we know there are a couple of nightclubs where, although you can't demonstrate cause and effect, a number of people have said that they've been in there in the period during which they may have obviously contracted the virus. So it does give us a lot of insight and information. So we do encourage people to continue to engage with that process. If we just go down to the testing, so keep going. So these are our PCR sites. So I mentioned this before. We've got the regional testing site in Kettering remains, the local testing sites in Corby, Daventry, Kettering, Northampton, and Wellingborough. And as I said, please do remember these are for PCR tests, so people who are symptomatic or those contacts who have been identified who need to have a PCR before they return to work. And then we've got the mobile testing units, which we continue to obviously move around the county dependent on the number of cases and any of the other challenges, potential outbreaks, etc., that we may want to support. If we move on. There we go. So it just gives a little bit of information about utilisation. You can see they aren't, 100% utilised, and then therefore, obviously, that's one of the reasons why the government is moving to a more mobile and agile way of working, so that obviously we're taking not only the tests to people who most likely to need them or least likely to engage, because there's two different types of approaches, but also it's to make sure that over time we don't obviously continue to fund something that is being underutilised. So it is worth keeping an eye on some of the utilisation of the site, so that you can understand why sometimes we change our tactics, and the government obviously ask us to do so too. If we go down to the lateral flow testing information. So obviously, just to remind people, this is for tests for people who don't have symptoms, and they can obviously be collected from the asymptomatic testing sites that we just spoke about, and participating pharmacies. There's over 120 participating pharmacies. You can also order them to be home delivered, and obviously lots of workplaces and schools, etc., have still got them in place as well. If we just go down. So these are the asymptomatic testing sites. So as I said, we've reduced the number of these, and we've now got obviously our mobile van that goes out as well. So these three still are in full swing. And again, you can obviously go and have both a facilitated site test, but you can also pick up your home testing kits from them. And then if we just dip down to again, you've got some of this is the door-to-door teams and where they'll be visiting, and the number of test kits handed out. So you've got some more new information about that service there. And again, you can see it's focused very much on the areas where we've had enduring transmission in the community. If we go on to the next slide, again, provides you a bit of information about the utilisation of some of the sites. And then the community pharmacy slide, hopefully is the next one. Oh, next. There we go. So 121 community pharmacies you can see scattered all over the county. So if you can think about that map, combine it with the PCR testing sites and the asymptomatic testing sites, we've got a brilliant provision across Northamptonshire. So again, I'd just recommend that if it's useful for councillors to use this information to provide it to all of your constituents as well, so that they're absolutely aware of how and when they can get hold of testing kits. Personally, I still get mine home delivered as well. That's one, particularly if you're working, it's one of the easier things to do, and they usually get delivered within 24 hours. So that obviously is the other bit to add, is there is that service. And you can find out more. We've always got the links through to both our local website, but also some of the national NHS resources as well. So I'll stop there and take any questions.
Okay, thank you, Lucy. We've got Helen first. Helen.
Thank you. Apologies for having my video off most of the time, but my connection is very unstable. Lucy, I was interested in what you said about the possibility of the fact that double vaccinated people no longer have to isolate, and that might improve getting information on contact tracing, because people will not, they'll be more happy to give that information out. And it'll be interesting to see if that is the case. That would be quite a key data set to look at, because obviously it gives a real opportunity to tell those people that about the ideal testing regime that they ought to be engaging in as a response of being in contact. So that sort of seems like if you're right, and if we do get more information forthcoming, that could be, you know, on the other side of worrying about the fact that double vaccinated people no longer have to isolate, it might also, there might be a little bit of a bonus there. So I think that might be something to really watch.
Yeah, I mean, it's going to be one of those really interesting sort of social, not experiments almost, but do you know what I mean? Kind of the kind of social observations about different behaviours, because I think a lot of people were concerned about dobbing someone in, particularly when we were in lockdown, because they potentially were seeing people they shouldn't. And so you always found, you know, we were never going to get 100% sharing of information because of those circumstances. I am heartened that you know, early signs suggest people are much more likely to share information now. But you're right, if we can get that information, we can give them the optimum advice about how best under their circumstances, and dependent on whether they're living with people who are vulnerable, what their work type is, all those kinds of things, you can give them the best advice around testing. And obviously it's just another opportunity to make sure as well that people are cited on the services that we do provide should they need to isolate. The government are really keen that we move from, you know, the sort of blanket testing of everybody to specific case finding. And that's why, you know, if you have been exposed, PCR is absolutely recommended. And then, as I said, you know, you can follow up with lateral flow to be sure, you know, particularly if you work or live with people in vulnerable situations. So it's a really good opportunity, but I'll definitely give you updates over how that changes over time.
Thank you, Helen. Thank you, Lucy. Any further questions on this section? Okay, we will move on to Kath, if that's okay. Kath Hall, who, Kath, what's your official title?
Media Relations Specialist is my job title.
Good. And just for the point, Lucy did mention at the beginning of the meeting that Northamptonshire has been nominated for an award nationally, recognising a lot of communications work going back, way back to the beginning of the whole COVID journey. And so that's testament to the work that the system has done, and more importantly to you guys in comms, because I remember the number 10 task force people coming along and speaking very highly about the work that was being done here, and that was taken away and used and, you know, replicated across the country. So that's really good for some good recognition, and good luck to everybody in the team when the award ceremony or whatever it is takes place. So over to you, Kath, if that's okay.
Thank you. So thank you very much for that. I'm going to touch on that in a little bit, but just a few updates really. So as we've come out of step 4 and into as normal a life as we've had for a long time, our main campaign is to be kind and bear others in mind. So as I mentioned before, in response to Emily's question about face coverings, we're trying to do a lot about helping people understand high risk situations, people, settings, and the measures to take in those situations. And, you know, we're always responding to what's happening on the ground. And like you say, there's more flu now, more norovirus, and it's, you know, quite right to advocate that those things were not circulating as much when we were all social distancing and wearing face coverings. So it's a really valid point. We've got a GIF on our, which is a set of images that move through social media channels. So that's shared across the public health channels, the North and West Northamptonshire channels. And that shows you that all of the different settings, people that might be at risk. When you meet with lots of people, it's obviously higher risk than if you're just meeting one-to-one. When you're meeting outside, it's better than meeting inside, etc., etc. So that should be available. And we've got an animation coming as well, which showcases a family of 4 and also some grandparents. And that just takes you through their kind of week and the different attitudes within the family about towards returning to normal, some more cautious and some less cautious, and obviously the grandparents as well. So hopefully that will be ready next week and we can share that as well. We've also had some feedback from our environmental health colleagues that small businesses in particular really suffered with the pandemic, and they're still just as at risk with potentially getting COVID. So if you've got a small business and there's just 2 members of staff and one is, say, contracts COVID, it makes the business very hard to sustain during that period. So we've done a poster for those small businesses, barbers, hairdressers, small shops, just saying, I think it says, just one exposure could lead us to closure. And again, that asks people, customers, to wear face coverings, to socially distance and protect the people that are running those businesses. So again, if that's useful to you or anyone that you're working with, we're happy to share that digitally or get some more printed. And then again, as mentioned, the deadline for health and care workers to get their first vaccine is the 16th of September. So my colleague Caroline in our comms team is doing a lot of work with the care home teams and adult social services across both North and West to work with them to try and help more health and social care workers take up the offer of the vaccine. Lots of work has been done to try and engage with those communities, understand the barriers, and there are many and they're very varying. So there's a lot of work going on with that to just try and increase those numbers. A myth bust, it's still a big part of the messaging, particularly around fears around fertility. It's one of the big things we're having to kind of counter at the moment. So really trying to reassure people that the vaccine is safe. So that continues. Lucy mentioned that we're doing some work. We've got a testing van now. Anyone who follows our social media might have seen pictures of it. So it's just a big transit van really that goes around to what we might deem harder to reach communities or communities that maybe don't engage in some of the more traditional activities. So the testing team go out and engage with those communities. They do some door-to-door contact with local people, inform them about the testing, what it's for, educate. It's very kind of transactional, not sort of lecturing. It's very much just trying to kind of encourage people to take up regular testing and the benefits of keeping their family members safe, colleagues, people around them. And they give out test kits. They can actually do tests for people, so assisted testing. So just basically kind of really trying to reach people that might not have engaged with us. So each week we promote on our social channels where they're going to be. They attended a couple of festivals at the weekend, which we've had some really good feedback from people that were there. So that was really nice as well. And as Lucy said, it's really trying to get into those harder to reach communities now rather than kind of a mass education. Self-isolation changes. So they came in obviously on Monday. We're just developing some assets. There are some government assets that are very good, but we're just developing a couple of localized ones to make it clear to people what guidance applies to you depending on whether you've had one vaccine, two vaccines, no vaccines, and whether you've completed your 14 days post-second vaccine. It's all very complicated, but trying to put that into a simplified format so it's clear for people. And really, as Lucy mentioned before, trying to reinforce the importance of having that PCR test. And obviously, the government guidance recommends that people take that test as soon as possible. And as Lucy said, sometimes that incubation period's a little bit longer. So we're just trying to make sure that people still adopt those protective behaviours in that space of time. So maybe wearing face coverings, keeping socially distanced, not mixing with too many people, just to be sure that they're not carrying the virus and infecting other people during that period. Our team don't necessarily lead directly on the vaccine comms, but we work really closely with our colleagues in the NHFT who do. So there's a lot of work now going on to reach the 16, 17-year-olds and those with an 18th birthday approaching. It's a bit confusing because they access their appointments in a slightly different way at the current time, but we're doing a lot to push that. And Ed said yesterday, vaccine uptake in that younger age group, as Lucy's just reported, has increased somewhat. Well, it's increased a lot in the last couple of weeks, so they're really pleased. They're saying that 30 to 39-year-old group is a little bit of a challenge at the moment, so have to have a little bit of a look at that. A couple more things. The COVID comms cell is actually being de-escalated because the level of work as we return to normal has obviously de-escalated as well. So resources will be spread back into the North and West Comms teams. So it'll become part of business as usual. So very much like the rest of the COVID activity, we want to try and learn to live with COVID as we live with flu. So you'll start to see, hopefully, less concentrated activity, but it will still be being run through each of the 2 unitary councils. And then finally, Councillor Golby mentioned that we have been shortlisted for an LGC award. Really pleased about this, obviously, but the 3 aspects of the award that we wanted to focus on is that all of our campaigns have been very much evidence-based. So we were one of the first counties to identify car sharing as a risk factor in transmission. We obviously had the largest outbreak in the country, and the evidence that we learned from that about the car sharing, the buses, the inter-household transmission, socialisation. There was so much that we gained from kind of working with colleagues on that to try and share with other workplaces and stop outbreaks from happening. So it was really, although obviously nobody wants the largest outbreak in the country, we learned so much from that. We did so much translation work and we worked with lots of local communities. So there was so much to gain from that. And as Councillor Golby mentioned, when the Cabinet Office did their visit, they highlighted the partnership working and said they really couldn't tell who was from what organisation because the work was so kind of collaborative, which was really good. So partnership working is the other thing we've really highlighted, and having colleagues like Simon, colleagues from the CCG and hospitals working alongside us all of the time has just been key to how we deal with this. And being able to really target comms. So when we had our problems with Corby earlier this year, really understanding the specific issues that were unique to Corby, with so many people still having to go to work, switching around of childcare bubbles, and being able to go to the local population and say, look, these are the things specifically happening in your area, and this is why we need to try and find other ways to deal with this, really helped us to overcome it. So fingers crossed, and thank you for all your support towards that, because it's been a collaborative effort. That's all for me.
Okay, brilliant. Thank you, Kath. I think it's fair to say if there's any information that you think councillors could possibly help or share, just please send it out, and we will try and do our best to disseminate it and send it out through a different channel. So feel free to send anything through, Kath. Are there any questions or comments from colleagues on the call? Recoms? No, I think you're okay, Kath. Good. Okay. Well, that brings us. That is the last item on the session today. So I think it's been really good. We've had some really good engagement, some very good questions. Emily put a point in whether Lucy could pick that up about lateral flow waste. Whether maybe you could take that away, Lucy, which is I think is a really good point. So yeah, we've got the next meeting is on the 14th of October. So we'll see how the world looks then, and hopefully things are steadying down. But as we've said a number of times, we're going to have to be dealing with COVID as a sort of part of everyday business. So we've got some great experience that we've put together throughout the whole process, and the challenges that we've faced together as a system. That I think we've done, as good a job as anywhere in the country, really, and hopefully that will be recognised, and it has been noted by that award nomination. So at that point, I will thank everybody for their attendance. Hopefully see you on the 14th of October, and